now. If you know someone who may be struggling with addiction, there are treatment centers available to help.
Dr. Omar Faruk from the Right Choice Health Group is here today to talk with us about treatment options. Dr. Faruk, good to see you.
Good to see you. Thank you.
So right off the bat, why do we call it an addiction? Many people wonder, isn't it just bad behavior and we're making it into an addiction? But that's for a very good reason, isn't it?
Very, very good point, right? That has been the point. People calling it addiction bad behavior, addiction is a moral failure. Actually, research says addiction is a chronic brain disease like any other chronic disease. So we have to treat disease as a disease.
And last year alone, how many people passed away in America because of this?
I think we brought up this issue last time. Almost like 60,000 people nationwide died from just opioid alone, overdose.
And why is it so addicting? I think it's easy to say, well, why can't you just stop your drug of choice or alcohol? But it's not as simple as just flipping a switch, is it?
Yeah, Chris, is a wonderful question. I mean, look at the politicians even talking about just say no. You know, school, just say no. Just say no is not enough. When your brain chemistry completely changes over time when you use these substances, just say is not enough. You have to treat.
So how are you treating?
We are treating with called medication-assisted treatment, you know, FDA-approved medication. For opioid, you have Suboxone or buprenorphine, you can put under the tongue. And opioid also you can treat with Vivitrol, it's injectable. Alcohol, Vivitrol can be used, FDA approved. There are medications FDA approved. It's not like on the side where it is FDA indicated for those conditions. And people doing well, saving lives.
I didn't realize that. There is medication to help wean people off these addictions.
Over the course of time,
Is addiction something that strikes all age groups, all ethnicities, all income levels, or is there a certain, I mean, do some people have addictive personalities?
You answered all questions by your question, Chris. You know,
I do that a lot.
You do a lot. I don't know how do you know that.
You're welcome.
Thank you. So yes, it's every spectrum, every demographic, every geographic, every age group, it can get affected. But addiction is actually childhood disease. I did mention somewhere in another show, addiction is a childhood adolescent disease, and 50% genetic risk of having addiction if father or mother had addiction. But good news is this genetic risk could be wiped out if you actually could stop your children not to use those drugs. Once they don't use for like age 22, 23, 24, and parents use, these people actually can wipe their genetic predisposition, call it epigenetics. That means addiction has a better genetics and worse genetics. If someone has father or mother use drugs and they can carry 50% of genetics and 50% risk of having addiction, on the other hand, if they can be prevented from using drugs, you can wipe that chance.
Well, that leads to our next question. Where does prevention start?
Prevention start, as I said, just question came again, same way. Prevention start at home, at school, at churches, as public gathering and social interactions. That means we have to watch our kids, where they are going, what they're doing. Every day we need to talk about it, especially holiday coming. And we have to talk about treatment, we have to talk about very openly, you know, whether they're using anything or not.
So for more information, where can we go?
rightchoicehealthgroup.com. or call 413-271-7136, and someone is going to pick up the call.
Let's hope somebody does pick up that phone or go to the website and ask for a little help. Doctor, good to see you.
Thank you. Good to see you.
Thank you so much.
Okay, bye.